The patient I'm presenting today is a 15-year-old female with no current psychiatric diagnoses. Chief complaint of increased sadness and anxiety. She was referred here by her PCP because he did feel that she needed medication, but was not willing to do that for her. In the past and fairly recently, she has had an increase in suicidal thoughts and sad thoughts. These have been going on since 2019, but they've gotten increasingly worse over the past year or so. Many of those thoughts are related to the patient's grandmother passing away. They were pretty close, and she was really, really sad about that. She has trouble sleeping most nights. Melatonin is somewhat effective, but not totally. She's also experiencing some tearfulness, anhedonia, and again, suicidal thoughts that are fleeting. She denies a plan or intent to act. The worst of these happened last year at school. Patient was able to reach out and tell a teacher about it, and teacher in turn reached out to the counselor, who reached out to the parents. Parents took her to the ER for an assessment, and they safety planned her home. Patient denies non-suicidal self-injury. In regard to her anxiety, she worries about school and maintaining her grades. Her grades are good now, but she often gets worried about maintaining those good grades. She gets anxious about being around big groups of people. She gets overwhelmed. She gets tearful. Sometimes she gets short of breath. Again, in regard to treatment history, she's never been on any meds before. She's not currently active in therapy and has had no inpatient hospitalizations. She denies psychosis and denies any trauma aside from the death of her grandmother. As far as her medical history goes, she has no known drug allergies. She does have asthma, but it's under control, and she really only has a rescue inhaler for that, so it's not too bad. She denies any medical hospitalizations, and her pertinent ROS was negative. In regard to her social history, she's a freshman at Delta High School. She's performing well academically. She's socially active. She excels in math and science. She has a blended family that lives with mom and stepdad. Siblings are all older and out of the house. There's no meaningful contact with bio-dad. She's eating and drinking well. She's not sleeping well. She's having trouble initiating sleep and getting approximately 6 to 7 hours of sleep a night. She has 3 English bulldogs at home that she loves dearly. She is currently single. She is heterosexual and identifies as a female. Her hobbies include watching TV, riding four-wheelers, and spending time outdoors. In regard to her family history, her mother has a history of depression, and she's on Lexapro for that, and she finds it to be effective. We don't know about the paternal side of the family. She denies any legal history. She denies any history of violence. In regard to her mental status exam, she is healthy, well-groomed, mildly anxious. She's cooperative. Behavior is appropriate. Speech all falls within normal limits. As far as her mood goes, she's depressed and anxious, and her affect is congruent with the stated mood. She denies auditory and visual hallucinations. Her thought process is linear and goal-directed. Her thought content, she denies SI, NSSI, and HI. Her insight and judgment are intact, and cognitively, she has met all of her milestones and is performing at or above her current grade level. As far as the plan goes, we're going to recommend therapy. We're also going to initiate Lexapro 5 in the morning for depression and anxiety, and follow up 1 month for updates.